There is a serious shortage for personal support workers. In Hamilton, the nonprofit organization Thrive Group is putting out the call to help. Sandra Watt joins us this morning with more. Good morning, Sandra.
Good morning.
So tell us about the different sites that your organization works with and operates.
We have 4 primary organisations under the umbrella of Thrive Group. There's Able Living Support Services and Capability Support Services. They are 2 community care organisations that go into people's homes and help them to live independently, as well as we have a number of congregate and group home settings for individuals with disabilities as well. And then we have 2 long-term care retirement homes. We have Idlewild Manor and St. Peter's Residence at Shadoke, and in total we serve about 400 residents in both those long-term care facilities.
Mm-hmm. We hear about the shortage of workers at long-term care facilities, but are you seeing it kind of organization-wide?
Absolutely, yeah. And I mean, even before the pandemic, we did have a shortage across Ontario of healthcare workers. The pandemic has certainly just magnified that for us. We've had to look after certain restrictions to make sure the virus didn't spread. So healthcare workers have been restricted, for example, in long-term care to working in just one location so that there's no spread of the virus. But as well as that, there is a shortage. We know that people are not choosing healthcare as a career field as well. So we're experiencing a lot of shortages. So we're having to get very creative in how we attract and retain employees.
Right. You've placed a great ad on YouTube of current employees, many long-term employees, talking about what a great organization it is to work for. What kind of workers specifically are you looking for? Because a lot of it is support.
That's right. Yes, we are specifically looking for personal support workers, as well as personal attendants. So at Thrive Group, we're very focused on training and supporting our employees to continue their professional development. So in our community programs, we will hire people who don't have previous healthcare experience, but have a real passion for working with seniors or people with disabilities. In our long-term care facilities, we do need to have personal support workers who are certified. We're also looking for registered nurses and registered practical nurses, as well as dietary staff. So those are sort of the primary positions that we have vacancies for right across. We've 17 sites in total, so right across the Golden Horseshoe, down to Dunville. We've just opened a new program in Hagersville. We've programs in Paris, as well as, like I said, Oakville, Burlington, Hamilton.
Mm-hmm. And are these full-time positions or are they part-time?
We actually are hiring for full-time positions. What we're really trying to do is make sure that we give people full-time jobs with pensions, benefits, and to make sure that we really do retain people. Healthcare work is normally very part-time work because of the nature of the work, but we really have chosen to make those as many full-time jobs as possible.
Right, right. And then that's kind of one of those good things that have come out of the pandemic is that before it was very much piecemeal. You would work at one place or another or maybe 3, but now it's like you've got one steady job. You're not moving around all over the place. So if people are interested in your training and are interested in the job applications, what should they do?
They just need to go onto the web and go to www.thrivegroup.ca and click on our careers page, and you will see a number of vacant positions, and our HR recruiters will be very happy to return their calls and set up interviews for them.
Okay, thanks very much, Sandra, for your help and for your work in the community.
Thank you very much for the opportunity to talk today. Take care.